and welcome to our special show. COVID has shaken up the world in more ways than one. While COVID has given rise to new challenges and uncertainties, the pandemic has also yielded some valuable lessons. What we eat, our exercise habits, general hand washing and hygiene awareness have garnered greater focus. While dealing with COVID, we overlooked the fact that people's lifestyles were severely disrupted, and as a result, metabolic problems have become more common. Unhealthy eating habits, lack of physical activity and mental toll of quarantine, isolation, and even the fear of contracting the virus all have adversely impacted people with diabetes and heart disease. A multi-sectoral approach promoting healthier diets and increasing physical activity can help slowing down the diabetic epidemic and heart diseases. Today we have with us experts to share with you advice on leading a healthy life. Well, let's introduce our panel. We have Dr. Rohit Aggarwal, consultant diabetologist and endocrinologist, Director, Aggarwal Health Center and Eye Hospital, Patiala. Dr. Kelli Chinnababu, diabetologist and consultant physician, Arkaya Health Center, Srikakulam. And Dr. Rajeev Kishore, consultant physician, diabetologist, cardiologist, Diabetes Management Center, Healthcare Solutions, Agra. Thank you so much, doctors, for joining us on the program today. Now, Dr. Rohit Aggarwal, first to you, do people with diabetes need to worry about DKA, that's a diabetic ketoacidosis, post-recovering from COVID infection?
Yes, ma'am, definitely. This is an area of concern. We people are encountering more and more patients who develop diabetes even after discharge from hospital. What we have seen, those patients who were not diabetic at the time of admission, the prevalence of new onset diabetes after the discharge is close to 30%, which is a very huge figure, and that's a very worrisome for we people also. What could be the reasons? Reasons are multifactorial. Could be the stress which the patient had while the patient was there in the hospital. Could be because of overuse of steroids in the management of COVID-19. And lately, what has come out that the spike proteins of the coronavirus itself can cause damage to the beta cell of pancreas, and hence the patient can land into diabetic ketoacidosis, what we called as DK.
All right, important points to keep in mind there. Dr. Kelli, type 1 diabetes happens generally in children, and there are people in which COVID leads to the development of diabetes. Does it always cause type 1 diabetes?
COVID-19 leads to the development of diabetes in type 1 children. See, type 1 is an autoimmune disorder in which the immune system attacks and destroys the cells in which the pancreas producing insulin in the pancreas. It leads to the hyperglycemia. Where COVID-19 and type 1 diabetes, the COVID-19 virus binds to the ACE2 receptors and TMPR receptors that found on the many organs. It involves in controlling the blood sugars, pancreas and liver. Mainly they attack the immune system and there will be a sudden loss of insulin production. Thus it leads to the hyperglycemia. So there are many other conditions in COVID patients where the use of steroids, it leads to the development of diabetes. And stressful conditions in the COVID patients, it will lead to the development of diabetes. And COVID-19 only triggers the development of type 1 diabetes, but it will not always causes the type 1 diabetes.
All right, so various factors come into play here for those who develop diabetes post-COVID. Dr. Rajeev, pulmonary embolism has been reported frequently in COVID and is often noted in patients with COVID without other standard risk factors. So if you could explain this to us, and can it cause a heart attack or cardiac arrest?
See, what happens in COVID, it's very much a strange disruption of the whole body coagulating mechanism. And as erroneously thought by some people that aspirin helps and maybe prevents this, but it's not like that. Aspirin doesn't prevent, you cannot prevent the COVID. You need the newer anticoagulant drugs, to get hold of this particular thing. You need drugs like apixaban or rivaroxaban or maybe low molecular weight heparin. It's a different ballgame together, Many people think they are already on aspirin. Many cardiac patients are already on aspirin. And they think that is sufficient to ward off the thrombosis. This aspirin is basically a platelet inhibitor. It can ward off the heart attack due to the cholesterol problem. Because we've seen all sorts of coagulopathies in this COVID. We've seen clotting in the intestinal arteries leading to intestinal gangrene. we have seen a cerebral infarction leading to paralysis and all sorts of cerebral disorders, and we've seen complications in the heart. You've seen acute MI zone, and the pulmonary bed embolism is very, very common because pulmonary bed is very vascular. And once these clots set in, they can dislodge and they can shift from the pulmonary veins to the other systems, that is equally dangerous. So the many things were found out later on. Initially in the first wave, we really did not know what was the scenario. So we are just giving aspirins and things like that. Then in autopsy, it was really found that it's a real different kind of thrombosis taking place. And in spite of drugs, still some people, even the vaccine is getting some complications like that. So late COVID complications. So it's the vaccination is a kind of mini COVID after that. So many people, even after 3 or 4 months after vaccination, or even 6 months after COVID, they're coming up with complications like cerebral infarction, myocardial infarction, pulmonary embolism, and many of these are very life-threatening. Even if diagnosed early, even the best of drugs sometimes are just not, you can't save the patient. So it's very, very serious matter. And if you start them early, if he is there on prophylaxis, every COVID patient, I believe, should have been given proper coverage with those newer anticoagulants apart from aspirin. So that is a message they should go forward, that only aspirin is not sufficient to prevent the coagulopathy caused by this COVID virus.
Dr. Rohit Aggarwal, healthy lifestyle changes are always good. Cutting down sugar in your regular diet can help. But is it true that diabetes is caused by eating too much sugar?
Ma'am, actually, this is a myth that diabetes is caused by eating a lot of sugar. So the concept is anything in excess, we know that it is not good for the health. Whether it is sugar, whether it is fats, anything, whatever we take. So that is the concept, and whatever you take minimal amounts and frequent intervals rather than large thing at a single time. Number one. Sugar itself directly does not cause diabetes, but if you consume large amount of sugar, at least it will cause the obesity. It will make the patient more insulin resistant, and this insulin resistance and obesity itself can lead to increased incidence of type 2 diabetes. So that is the reason we always say whatever you take, it should be in a minimal or in a moderation amount, and we should adapt the habit of taking the healthy foods. Like natural sugars which are available in fruits and vegetables, they are not linked to the diabetes incidence. That is the carry home message is, it is not the direct sugar which causes diabetes. It is indirectly way, if you consume sugars in a higher quantity, you will gain weight, your BMI will increase, you will become more insulin resistant, and these things can increase chances to become diabetic or other health related issues also. So the message is, whatever you want to have, eat in a smaller portions, frequent intervals rather than large meal at a single time. We should develop the concept of no feasting, no fasting.
Okay, no feasting, no fasting. Dr. Kelli, to you now. Some people with diabetes have an injection phobia regarding insulin. Some people with type 2 diabetes believe that starting insulin therapy is the last stage of type 2 diabetes. So can you clarify this? And do people who have type 2 diabetes develop type 1 diabetes?
See, in diabetes, say injection phobia, it is very, very common. Many people will think that injection is the last stage, and in severe diabetes only they will be prescribing, and many people it will be thinking that, but insulin is very, very painless. So when all the medications are failure, then we'll be prescribing insulin. There are certain other conditions, in acute conditions, illnesses, surgeries, pregnancies, where severe glucotoxicity, the insulin will be prescribed. And in hyperglycemic diabetic ketoacidosis and hyperglycemic hyperosmolar coma, in that conditions, insulin will be indicated. Where in other conditions, where early to start insulin, it will help in lower the blood sugars, and it will prevent in delaying the diabetic complications, mainly microvascular and macrovascular complications like retinopathy, neuropathy, and kidney diseases. And starting insulin early stages, it will helpful in the anti-inflammatory effect, which protects against the development of atherosclerosis, and it will protect the inflammation. So in that way, starting insulin early stage, it will help the diabetic patient to control the blood sugars to prevent the diabetic complications.
All right. Thank you, Dr. Kelly, for clarifying that and basically follow the advice of your doctors. Where you're watching Beat Diabetes, Myths versus Facts. Time for us to slip into a short break. We'll be back with more. Stay with us. Welcome back. You're watching Beat Diabetes, Myths versus Facts. We're talking to doctors and getting all the knowledge we can regarding lifestyles and healthy habits. We're joined by Dr. Rajeev Kishore next. And doctor, people who take cholesterol-lowering drugs assume that they need not follow a particular diet or have any restrictions on food choices. Tell us more about that.
So this is a myth. Actually, you can't just there's no substitute for natural diet. The pillars of any diabetic, diabetes is a metabolic disease, and the pillar, hypertension, diabetes, they're all obesity, they're all metabolic diseases and lifestyle diseases. So the basis of treatment of any of these diseases is definitely the lifestyle management. And lifestyle management includes the diet part, the exercise part, your healthy habits, decrease of stress, diminished smoking, decrease of very limited alcohol intake. All these things are included in lifestyle management. Because unless you do lifestyle management, you just can't, any of these diseases, whatever drugs you may take, even if you're on insulin, if you don't manage your diet properly and don't manage your lifestyle properly, you have stressed out. Stress is one thing which cannot be quantitated. There's no barometer, there's no thermometer, you can measure stress. We ask the patient, are you stressed out? He says, no, that's okay, you just lie down, he's not stressed. But internally that stress, kills the man. So stress, things like stress, anxiety, and lifestyle is something you can control. Stress, about aging, once you age, the passing on, as you increase in age, your risk increases. If you're a male, you're more at risk. So you can't change your sex, you can't change your aging package. So those things are always there. What you can modify, the modifiable factors are one you can change. They're the ones you can stop smoking or reduce smoking, reduce the amount of alcohol, reduce the amount of stress, and have a healthy diet. Healthy diet would mean a kind of a Mediterranean diet which has more of unsaturated, MUFA, monounsaturated or polyunsaturated oils, more of green veggies, more of fruits, more of fibers, things like that. So those are the kind of diet and healthy exercise, maybe a 20 to 30 minutes per day of, normal exercise type of things. So those things are really going to help you in the long run. And if you don't, just forget that I'm taking my drugs. Drugs are just a add on. They can help you, but only drugs are not going to solve the picture unless you couple up the drugs with proper lifestyle management. Taking only drugs is only part of the picture, You can't win the disease by only taking drugs. Drugs have their own problems, You take them in very high dose and they don't work properly. They are supplementary or complementary to your lifestyle management.
Dr. Rohit Aggarwal, people are still unaware of the importance of regular blood sugar monitoring. Now they think they will get some, symptoms if their blood sugar rises. Can they experience blood sugar rise without any symptoms?
Yes, ma'am, it's absolutely true. One can have the symptoms. Only one can have the high blood glucose level even without symptoms. So that's here the role of screening comes. Why we are screening lot and lot more and more people? Because we have come across a lot of patients who they say we are okay, we are doing regular exercise, we are taking healthy food, so why should I go for the checkup? So here, that's why we always say screen yourself after the age of 30 now. Previously we say start screening after the age of 40. Now we are saying because the diabetes is coming in a younger generation, you start screening yourself once you cross 30 years. One can have diabetes even without symptoms. To our surprise, yesterday was the World Sight Day. We did just a screening camp in one of the environmental park, and where we screened 100 patients would even with or without diabetes. And to our surprise, 7 of the patients who they don't know anything about their diabetes. They think we are okay. We are just checking our sugars because you are here. So and 7 turned out to be diabetic there itself. We did their HbA1c, and HbA1c was found to be higher. So meaning by that we should not go by the symptoms all alone, because symptoms sometimes they appear late, and in Indians we have a habit that if we have some symptoms like increased urination, or we are feeling thirsty, or there is a slight increase in appetite. We always say this happens because the change in weather, I am under stress. So we usually deny those early warning signs and symptoms also. So my message to the listener is, please, after the age of 30 or 35 years, do annual checkups, which is most important, because if we catch the disease early, we can treat either by lifestyle or with without medicine, as my professor has suggested, so that we can prevent the late onset both microvascular as well as macrovascular complications. And we know that prevention and cure, so early picking is more important for diabetes.
All right. Now, Dr. Kelly, generally eating fruit is a part of a healthy diet, but there's also a lot of confusion about having fruits, especially for people who have diabetes. Which fruits are safe for people with diabetes to have, and can they safely consume fruit juices?
Diabetic patients always think that they should not eat fruits. It is a wrong. Diabetes people can eat all types of fruits in a limited quantity and in a limited number. So they can take as a whole fruit. They should not take as a fruit juices. And safe fruits means which are having low glycemic index and a low glycemic load. The fruits which mainly guava, apple, citrus fruits, avocado, kiwi, these fruits, berries, these fruits can be taken safely, but in a limited quantity and as a whole fruit. And avoid fruits like jackfruit and mangoes.
Dr. Rajeev, post-COVID infection, the work-from-home culture is causing people to eat more, exercise less. So what are the ramifications of this on heart disease management, and how frequently should they consult a doctor for medication management?
See, it's a very important issue now, because now the work from home is carried on for a very long time. And when you are home, with family, normally we hardly get in time. Professionals, even doctors, used to get very little time with their family. They're busy all day. Now the family is there, and your kids are eating something. Of course, their grandchildren, children, when they're eating something, they tell you, okay, you also like to share with their eating and enjoying, you're watching a movie or chatting around. So the food you're taking, that the quantity and the quality has deteriorated because of that, because your restrictions are now have their own limitations. When everyone is eating, you can't tell someone on the table, someone is eating a sweet dish, and you tell others don't eat the sweet dish. So things have become different now, and you have to really exercise a lot of, self-control to avoid, getting these, get into the bad habits. You can have everything, like my previous speaker just said, that the quantity is very important. So very important is the portion size and the frequency. So you should keep a proper interval between your meals, you can have, say, breakfast at 8 and lunch at 2 and maybe evening tea at 6 and dinner at 10. And in the mid region, you can have something like fruits or some mild snacks. You can distribute your, the diabetic is always advisable to distribute your food into 6 or 7 small portions rather than having 2 huge meals a day. So there now the snacking actually just disturbs the carb balance. Your carbohydrate intake just goes for a splash, when you take all these snacks. So you have to exercise a lot of patience and a lot of self-control to do that. And when you're not working, actually, many people have their gym at their workplace, they're walking part to the workplace, but they're not going out, they're in the home. So a lot of people have gained a lot of weight in these periods, and their sugar control is gone for a toss.
Right.
So you should be more careful and check your sugars more frequently, and maybe consult your doctors more often. If not in person, maybe online, the online consultation could be another good thing, because you can get some good, the doctor can persuade you to, cut down on your whatever you're doing. But some people, just surprisingly, many people have taken a lot of liberties with their diet and still not gained weight, and still the sugars are okay. I don't know what were the factors involved. Maybe their BMR is more, or maybe they have less stress levels. We just can't say, because some things are unexplainable. Otherwise, normally things have gone for a toss, and you should be more careful and consult your doctors more frequently. Maybe on the phone, maybe online. That could be another option.
Well, maybe they're eating at home and not eating out as much, and that's also, contributed to their health. But thank you. Thank you so much, doctors, for joining us and getting us all the facts and busting all the myths around diabetes management. Thank you so much for joining us. Thank you for watching. Goodbye.